are coming from within the mind of the person that's experiencing it. I believe that our minds are, well, we could think of there's a component that we could think of as conscious. People generally use the word I to describe that, and that's the part of the mind people generally identify with. And then they call the rest of the mind self, and the rest of the whole thing self. So within mind, but not within where it's conscious, there's something that I call processor. Processor is the thing that is reading information and causing things to happen. Processor is dedicated to your survival and the survival of those things you value. In order to cause your survival, processor has to cause two different kinds of things to happen: internal, external. Internal: circulation, digestion, respiration, nervous system activity. External, though, that causes the person to actually get up and do something, say something. In order to cause those behaviors, mind causes emotion, thought, sensation, impulse, and habit. And with those tools, it can make stuff happen. And mind is causing then all of these feelings, including, when people say feeling, sometimes they mean sensation, like what you feel in your hand. Sometimes they mean emotion, like sadness. So I would do better if I could separate that and say emotion and sensation. Mind processor causes emotion, sensation, thought, impulse, habit in order to cause action. Your mind is looking for you to do stuff so you and those things you care about can survive. It's looking for you to do stuff. So if somebody is saying, oh, I'm having all these racing thoughts, or I'm feeling fearful, or I am feeling resentful, or I can't seem to get past this bad thing that happened to me earlier in my life, that's mind intending to do well, but dysfunctional.
Right.
So it becomes my job and the job of those people I'm training as facilitators to fix it. So I think if somebody comes to me and they're unhappy with the way they've been feeling, thinking, acting, reacting, interacting, what comes to mind, how effective they are, how motivated they are, what they dream about at night, whether they sleep or not, if they're eating in a healthy way, whatever the heck it is. If somebody is saying, hey, this is what's been going on, but I'd be better if it was like this, and I know that and it hasn't happened, I think, okay, that person's been stuck, meaning there's some kind of thing going wrong with the way stuff is being processed and things are caused to happen. And so then I think, okay, fine, you brought your mind with you when you came to me, and it's right there, and it becomes my job to fix it. So that's something that's, I think, significantly different between what we offer and what the mental health industry offers.